People have now died from COVID-19, and more than 70,000 have been diagnosed. The World Health Organization saying they fear the U.S. could become the next epicenter of the outbreak as cases continue to jump every day. Right now, New York is the center of the virus in that country, accounting for more than half of all new infections. Let's go to Hunter Walker, White House correspondent for Yahoo News. He joins us now to talk some more about this. Thanks for your time today.
Thanks for having me.
So $2.2 trillion available to Americans in sort of different ways, tax deferrals, stimulus, and direct aid. But what does it mean for the average American?
Well, let's be clear. Nothing is available yet. This did pass in the Senate. The House is voting today. But in this age of pandemic, there are actually questions about how they can manage to conduct a vote. All of the House leadership has expressed hope, President Trump as well, that this measure will pass by unanimous consent. And that means that there's not a single objection from the 435 members of the House of Representatives. If there is even one objection, there's going to need to be potentially a floor vote. And I heard from sources that House Speaker Nancy Pelosi was actually on the phone with her Democratic caucus saying to them that if this doesn't pass by unanimous consent, if there is objections, she's actually consulting with the House doctor to see how they might be able to pull that off. So there are still a couple hurdles here, and it's not really clear when this money is actually going to be reaching members of the public. But to your question, how much of an impact will this have? I think, broadly, the story of the American response to this pandemic is a tale of half measures. Our borders are not shut. We really do not have any kind of full lockdowns. I was checking yesterday, and I can still buy a ticket to fly from D.C. to California right now. And when it comes to this economic aid, in terms of aid to individuals, we're largely talking about $1,200 payments that will go to some people who are most in need. This is based on their past taxes, and it really doesn't reflect the numbers that we're seeing this morning, which are record numbers of unemployment. This is unprecedented.
You mentioned half measures, and maybe that's because you're getting a half message from your president, right? He's taking the stage every day with the experts and kind of telling people, yes, it's serious and we need to worry. But, for example, he'd like to see churches full on Easter, which is April 12th. And definitely the experts are not saying they agree with that.
The experts are not saying they agree with that at all. There are models showing that many, many more millions of people will be infected and likely die if we proceed on that course. And it's very interesting. I've been in the White House briefing room. The president is appearing, surrounded by officials. They are not social distancing in accordance with the White House's own guidelines. There have been multiple exposures on the White House staff. One of my colleagues in the White House press corps has a suspected case because when you go in that room, we are not even taking really the barest safety measures in line with recommendations. So there definitely is a disconnect between what we're seeing behind the White House podium and these really urgent and desperate warnings from experts, including, Johns Hopkins and the World Health Organization.
There are some who are theorizing that perhaps this could be managed state by state, meaning that because you're seeing California, Washington State, New York with these high numbers, that the state can control the situation, but other parts of the country which have not been affected might be able to open up a little bit more in a week, in 2 weeks' time.
I mean, perhaps it could be managed state by state, right? But we're not seeing that right now. I'm here in Washington, D.C., where, we're 200 miles away from New York. We have a number of cases here. And last night, the mayor issued a shelter in place, but it's basically an advisory. It's not really being enforced, apart from non-essential businesses being shut down. But many, many businesses are still open here. New Jersey, the governor just said that New York is the canary in the coal mine, and New Jersey, which is right next door, could be close behind. But again, we're not seeing any lockdowns. So, the experts are very clear. The only way that, we've seen success against this virus is really aggressive quarantine, heavy testing, and then isolation of those who do have the disease. And right now in the States, we do not have many tests. The president has falsely claimed we've done more tests than anywhere else. But when adjusted for population, that's just not true. And all of these half measures, including potentially, certain states deciding to be aggressive, are just leading to continued movement, in a population where we know this pandemic is spreading and we have not really tested enough people to have a handle on how big this problem is and where it is.
Yeah, it is. It still remains a very scary thing. Hunter Walker, thanks for your time. Thanks for weighing in on this.